Welcome to today's podcast. My name is Pearlie Burr, and I will be your host. Today's podcast guest is Roland Roy. Today we're going to talk to Roland about his new challenge that he has, and I guess he's been there a while now at NB Power. Welcome, Roland.
Thank you very much, Pearlie. Good to be here.
When did you actually start your position at NB Power?
So I started with NB Power in September of 2023. So it's been about a year and a half, a little bit more.
So what would your position title be there?
So my position at NB Power is Director of Total Health and Safety.
Okay. Now, for folks that haven't had the opportunity to get to know who Roland Roy is, why don't you take a few minutes and talk about your background in health and safety?
Certainly. So graduated from UNB with a degree in Bachelor's of Science in Forest Engineering, and worked in the forest industry for about 15 years. And then transitioned to health and safety. I started off as a health and safety officer in the Grand Falls area. And then that was back in 2003. And then in 2007, moved to the St. John area, again as a health and safety officer. And shortly thereafter, in the fall of 2007, started as the engineer for the Chief Compliance Office. With the Chief Compliance Office, I held various roles, engineer and Assistant Director of Compliance and Regulatory Review. And I was there until the fall of 2015. In 2015, I moved to the private sector and worked for Stantec Consulting out of their St. John office, and was responsible to develop, implement, and their audit system, internal audit system for health and safety. And in that capacity, I conducted audits for Stantec all across North America. And I was there until moving to NB Power in the fall of 2023.
So how big is your safety group at NB Power?
So NB Power, we have a good safety group. There are 17 of us that work in total health and safety. And then there are an additional 5 that work at Point Lepreau. So in total, there would be 22 safety professionals at NB Power.
So how many employees would you cover at all the different operations?
With all the different operations, we are somewhere between 2,700 and 2,800 employees.
Wow, that's a lot of people. So I guess a key question that when you took over your new position, always interesting to find out what people's philosophy. When you did take over the new position, what was your philosophy or approach that you used to sort of work yourself into the position? Sometimes you hear people talk about sort of they want to jump in and do things right away. Other people say, well, I want to take some time and sort of get to see the big picture, and then they start to make decisions. What was your approach?
So that's a really interesting question, Pearlie. And I was very fortunate that some of the work that I was doing while at Stantec, NB Power was actually in the process of implementing those same programs. So as you're certainly aware, incidents can be looked at in 2 different ways. Was there a substandard condition, or was there a substandard action? And most of the work that I was doing while I was at Stantec was dealing with substandard conditions. And what we had implemented at Stantec in order to address that was a program called the Energy Wheel. And the Energy Wheel takes your hazards and puts them into one of 10 different energies. So if you think of gravity, gravity is an energy, and there are 2 things that can happen with gravity. Either something falls on you, or you fall. You can fall same elevation or from a higher elevation. But those are basically the two things that can happen with respect to gravity. And as you go through the energy wheel and look at the different icons that they use to define the energies, you find that it gets very simple that way. So I was very fortunate that the work that I had been doing at Stantec was the work that NB Power was beginning their journey in. So I basically jumped in, both feet and have been working on that ever since. It's a very interesting program.
So tell me more about the energy wheel.
So as I mentioned, you look at substandard conditions or substandard actions. When we look at substandard actions, those are mostly human performance issues. And NB Power has a very strong tool chest for human performance. And a lot of those have been developed at Point Lepreau. And as needed, we take those and we put them into conventional safety. But with regards to substandard actions, as I mentioned, we use the energy wheel. Research has shown that the average person is able to identify about 45% of hazards on a work site. What the energy wheel allows you to do is to add about 30% to that initial 45. So people using the energy wheel will be able to identify approximately 75% of their hazards. I gave you the example of gravity. If I take an example of a biological hazard, that would be breaking it down to its most basic. It would be animal, vegetable, or microbiological. So something that you can't see. So when you think of that in that perspective, it becomes very easy to identify the hazards that are within the workplace.
So how do you go about now to implement that across the board?
So what we've done is we've actually modified what are called our tailboards. So those are our last minute hazard assessments that we use in the field. And we provide the icon, the 10 different icons for the energy wheel on the tailboard, and then ask the employees to go through icon by icon and look around their work site to identify those hazards that are related to those icons. So we do that on our tailboard, and we also do that on our field assessments. So every week, our supervisors are required to do a certain number of field assessments, and they are using the energy wheel to identify the hazards. Once they've done that, they have a conversation with the team that they are assessing, looking at their tailboard, looking at the field assessment to see if there's any differences between the two, and have a discussion on those hazards that were either missed during the field assessment or during the tailboard. It's a very interesting process.
So what kind of feedback have you had from your staff on that?
The staff love it because it brings it down to a very basic level. It's very easy to use, and they are realizing that they are able to identify additional hazards. And, you can only control what you measure. And if you can identify those additional hazards, you now have the ability to control them and put those controls in place.
Now, we had a chance at the Safety Services Conference in Halifax to talk a little bit about health and safety. You talked about the energy wheel. You also talked about an author that you have been following who has a bit of a different philosophy, I guess you could say, than a lot of people in health and safety, in that he talks about planning to fail.
That's right.
Do you want to talk about that a little bit? It's always interesting to sort of hear new philosophies or new approaches.
So that is very interesting. Dr. Matt Hollowell is the gentleman's name. Now, Dr. Hollowell did a lot of work with the Edison Electric Institute, and the work that he did with them is in developing a safety classification and learning model. So it is based on the energy wheel. And what that model says is that serious incidents are going to require 500 foot-pound of energy or more in order for the individual to sustain a serious injury, a life-threatening injury, or resulting in a fatality. And based on that, Dr. Hollowell evaluated approximately 23,000 different serious incidents and looked at those energies that were present that led up to those incidents. And he's identified some precursors. And there are 13 precursors to these serious incidents, and they're all based on high energy. So, for example, gravity. We talked about falls from elevation. In regulation, we say that you must have fall protection of some kind above 10 feet. Well, the research shows that you can sustain a serious incident at heights of as little as 4 feet. So that really gets you looking at safety differently. What are you going to provide to your workers who are working from elevations of 4 feet or more? Because the research shows that they can have serious incidents from as little as 4 feet. So the program goes and looks into what direct controls can you put in place to either eliminate or control those hazards. So it could be from 4 feet that you provide fall protection in the forms of a guardrail or in the forms of a self-retracting lanyard, which has a very short deployment distance. And the idea is that you provide a direct control that has the ability to absorb the energy that is released. So it has the capacity to absorb that energy. And there are actually some models called a capacity model that will look at those direct controls that will allow you to absorb that energy. A direct control what a direct control is not is something like training. Whether you have training or not, if you're going to fall, that training isn't going to reduce the energy impact. Our tailboards, although our tailboards are used to identify the hazards and put in controls, the fact that you're doing a tailboard isn't a direct control. You have to put in those direct controls, those barriers, in order to be able to fail safely. And that's the whole concept. It's not that you're trying to prevent all failures, is that you want to make sure that you have a barrier between yourself and the energy being released.
Now, have you had the opportunity to talk to someone that's actually implemented this in the past?
Yes, we have. And the results are quite impressive, I can say. And not only are you reducing the total number of incidents that you're seeing, but you're also reducing the severity of the incidents that you're seeing. Over the last few decades, there's been a significant reduction in the total number of incidents recorded, but the severity for those severe incidents, that's been relatively flat. And the hope is that with the introduction of the safety and classification model and implementing those direct controls, that we are able to start reducing those more severe incidents.
So is this an approach that's been used a lot in the utilities field, or is it one that's gaining traction pretty much in a variety of industries?
So a lot of the initial work with regards to the energy wheel was done with the construction industry. But most of the work done for the safety and classification and learning model, the capacity model, has been done within the electrical industry.
So when you started at NB Power, if an employee came to you and said, welcome, nice to have you on board, all those kind of things, and then asked you the question, what's your philosophy on health and safety, Roland? How would you answer? How would you go about to answer that?
Philosophical questions are always difficult to answer. At its root, we have to go back to saying that health and safety is an internal responsibility system. Everybody has a role to play within that system. From the employer in putting those proven and known programs in place that will assist the employees in identifying the hazards, having the employer provide the resources necessary so that the employees can put the controls in place once they've identified those hazards. And then finally, taking the input from these incidents and looking at what the learnings are and sharing those learnings with the employees. That would be the other responsibility of the employer. So that would mostly encapsulate my philosophy. Now,
in the use of data, I would assume at NB Power you have a fairly robust data collection system.
We do have a good data collection system, but there's always room for improvement. So we are considering what other systems are out there and how could they improve our data collection. And really, data collection is at the base of the issue. What we want to do is really on the analytics. That's where we want to be able to shine. It's only the analytics that are going to be able to drive your safety system forward.
So what would you look for in a good analytic system?
So a good analytic system would allow us to do linkages. So at NB Power, we have different divisions. We have our nuclear division, our generation division, conventional generation, and then we have transmission distribution. If we're looking at those groups as an aggregate, we may be missing some of the trends that are happening within certain divisions. So analytics should allow us to look at data division by division in order to make sure that the programs that we're implementing do have an impact for those divisions. It's not always a one-size-fits-all approach that is best.
Leading edge. We hear people continually talk about, well, they want to be leading edge in their approach to whatever the topic is. If you were looking at wanting to be the leading edge of what's happening in this day and age in health and safety, what would be some of the things you would want to undertake?
So we've talked about the energy wheel. The energy wheel is leading edge. We've talked about the Edison Electric Institute safety classification and learning model. That also is leading edge. The next thing that we're looking at is high energy control assessment, HECA. So this is very much like a field observation. But what you're observing is you're observing based on the energies for the job that is taking place. And you're trying to identify those high energy situations. And then the next step is you're looking for those direct controls. So we'll go back to fall protection. Somebody is working at an elevation of more than 4 feet. You want to see if they have some type of fall protection in place. If they do, that is a controlled energy. If they don't, it is uncontrolled. You can then start looking at the aggregates of your field observations to see where you have uncontrolled high energies. And you can target your communication and your programs to address those areas where you are deficient. I'll give an example. It's construction season right now. And for most construction sites, the controls are a flagger and some temporary barricades. If a car is coming down the highway at 80 kilometers an hour, those temporary barricades, those candles or those drums, and that flagger will not stop that vehicle. So that would be an uncontrolled situation. However, if you have a concrete barrier, a Jersey barrier, that would either redirect a stray vehicle or stop a stray vehicle. So that would be considered a direct control. So you can now start looking at where you have the highest percentage of uncontrolled high energies in order to put programs in place to mitigate those areas.
Great example. Now, I want to give you another example. It's the middle of the winter. We've just had a big snowstorm. Your crews have been called out to work on the lines because a lot of the lines are down, trees over the lines and so on. How would you go about to control that kind of situation?
That's a very good example. So there are two areas that we need to control. That would be considered motion. And motion we would look at from two different perspectives. The example I gave previously would be from a worker on the side of the road perspective, so a pedestrian. The example you're providing is from the driver of the vehicle. So when we look at that, we consider what are the direct controls that would be built into the vehicle that would help reduce the severity of an injury should there be an incident. And for that, we have seat belts that are mandatory, and we have airbags that are on most vehicles. So those would be considered two direct controls. They will deploy without needing any assistance from the worker. So the worker gets into his car, he clips in his seatbelt, and that seatbelt is ready to deploy should there be an incident. The airbag, there's absolutely no input from the operator of the vehicle. If there's a collision that is significant enough for deployment, that airbag will deploy. And those would be considered direct controls.
What about for the guy up in the bucket?
So the guy up in the bucket, again, here we're talking about gravity. What we do have at NB Power is all our trucks go through an annual inspection of the hydraulic system to make sure that the hydraulic system is in good operating condition. And then we also have administrative controls where bucket work is not permitted above a wind speed dictated by the manufacturer of the equipment. So the annual inspection, that would be considered a direct control. The administrative control of not going up in the bucket above certain wind speeds, that would not be considered a direct control.
Okay.
And then obviously any work in a bucket truck, workers are required to have fall protection, and then fall protection would be considered as a direct control.
So you work for an organization a very large organization that's spread out across the province. How does Roland Roy make out getting out into the field and trying to sort of stay in touch and see what's really going on out there? I mean, you've got a big province, you've got so many different facilities, so many different divisions. How's that working for you?
So that part, Pearlie, is a challenge. It's always a challenge to get out in the field. And to that, we are lucky that our leadership has identified that not only for our health and safety team, but for our leadership team as an organization. And we've implemented, and I'll be frank here, with more or less success, a meeting-free Tuesday. So the executive has taken it upon themselves not to schedule any meetings on Tuesdays, allowing the executive and leadership to get out in the field and make their presence known. And I think that is a great opportunity for us to leverage that, to be able to get into some of the more, I don't want to use the term remote, but further areas for our plants. As example, Beldoon and Eel River.
Okay. Biggest challenges at NB Power going forward? What would you see in health and safety? What would you see the biggest challenges in health and safety?
So I've spent a lot of time talking about the programs that we're putting in place to try to improve our health and safety performance. One of the biggest challenge that we're having right now is implementing the regulatory amendments that are coming through from WorkSafe New Brunswick. WorkSafe New Brunswick had announced 3 phases of regulatory amendments to the Act, to General Regulations 91-191, asbestos. So keeping up with that and implementing those changes into our programs, into our safe work practices and standards, that is challenging. This third phase of changes that is upcoming, WorkSafe NB announced 13 areas of change in the next round. Of those 13 areas, 12 of them affect NB Power. So it's a lot of work for us to look at those changes, see how it's going to affect the way we do our work, and to integrate them into our programs.
So the next 3 to 5 years, how do you expect health and safety to change?
So looking at how the energy wheel, the Edison classification model, the capacity model, seeing how that is being accepted not only through the electrical utilities, but in construction in general, I see that being a big driver. The one interesting thing with that system, Pearlie, and I didn't mention this before, but because it is based on a defined energy level, 500 foot-pounds, we are now able to look at what other utilities are doing, and we know that we are classifying our incidents in the same way. So not only do we have the benefit of classifying our incidents, but we can now learn from other utilities, knowing that they're classifying using the same system we have, and that the learnings that they're coming out with would also be applicable here at NB Power. So I see very much that there will be a lot more opportunities to share information. Now, that being said, the other interesting area is going to be AI and how artificial intelligence is going to change our ability to do health and safety. And there are some wonderful tools that have come out in the last, I'd say, 3 to 6 months, and very exciting looking at those tools.
Now, we're pretty much out of time here today, but why don't you provide us a teaser, and then we will get back and do another broadcast on AI in the future. Give us a teaser as to what you have already seen relative to the use of AI as it affects health and safety.
So I've talked about the high energy control assessment, and how we are using that to identify those high energies that are controlled versus those high energies that are uncontrolled. There is a AI tool that has been put out in the last few months by Dr. Hollowell, where you can actually take a photo of your work site and ask AI to do the assessment for you. And not only will it identify the high energies, it will also identify what controls you have for those high energies. And it will go the extra step to tell you that if there's a possibility of a high energy being there, but it's not, it will let you know. And the greatest example I can give you is somebody working from an elevated work platform. So it will identify gravity as being an energy, more than 4 feet as being high energy. The platform has a guardrail, so there's a direct control. But then it will go on to say that the employee in the platform does not appear to have any tools, so there are no high energies with respect to dropped objects. So that's very exciting, and we have just started looking at that, but I can see tremendous applications for that.
Okay, well, I'll ask you at this point then to save those examples, and in a future podcast, what I will do is we'll get a hold of you, Roland, and we'll ask you to come back on the podcast, and we'll address the issue of AI. Fascinating issue. It is going to have, I'm sure, a tremendous effect on health and safety. For today, that's our time, I guess you could say. Thank you very much for coming on our podcast and giving us a sense at a high level as to what's happening at NB Power when it comes to health and safety. Thank you very much.
Thank you, Pearlie. It was a pleasure.
So for the folks listening today, we would appreciate any feedback you'd like to provide to us on topics or guests for the future. Otherwise, stay safe. We'll see you in a week's time.